Fortunately, because of the Affordable Care Act, I remained on my parents' insurance while in grad school and was able to receive the treatment I needed at an affordable cost. Thank you, and now it's my honor to introduce the President of the United States, Barack Obama.
Great job.
Thank you so much.
All right. Thank you, Monica. We may never satisfy the law's opponents. I think that's fair to say. Some of them are rooting for this law to fail. That's not my opinion, by the way. They say it pretty explicitly. Some have already convinced themselves that the law has failed, regardless of the evidence. But I would advise them to check with the people who are here today and the people that they represent all across the country whose lives have been changed for the better by the Affordable Care Act. You know, the other day I got a letter from Julia Walsh in California. Earlier this year, Julia was diagnosed with leukemia and lymphoma. I have a lot of things to worry about, she wrote. But thanks to the Affordable Care Act, there are lots of things I do not have to worry about, like whether there will be a lifetime cap on benefits or whether my treatment will bankrupt my family. I've said very clearly that our poor execution in the first couple months on the website clouded the fact that there are a whole bunch of people who stand to benefit. Now that the website's working for the vast majority of people, we need to make sure that folks refocus on what's at stake here, which is the capacity for you or your families to be able to have the security of decent health insurance at a reasonable cost through choice and competition on this marketplace and tax credits that you may be eligible for that can save you hundreds of dollars in premium costs every month, potentially. Do not let the initial problems with the website discourage you, because it's working better now and it's just going to keep on working better over time. Every day I check to make sure that it's working better. And we've learned not to make wild promises about how perfectly smooth it's going to be at all times. But if you really want health insurance through the marketplaces, you're going to be able to get on and find the information that you need for your families.